Dandruff is more than just a minor irritation. It can affect our confidence, social interactions, and even our choice of clothing. But those flakes of skin can also lead to embarrassment, itching, and irritation. Hi, I'm Dr. Finbar, a GP specialising on dermatology, and in this video we'll explore the common causes of dandruff and scalp itching and provide effective solutions including natural remedies and medical treatments. Dry scalp refers to the dry surface layer of skin, which may occasionally lead to a few flakes of dandruff. Most people experience this now and again, and it can often be managed by using products that moisturise the scalp. Natural products containing oils like almond, coconut and tea tree oils are popular, but while they may work well for dry scalp, they can actually worsen dandruff caused by seborrheic dermatitis, and we'll explain that very soon. Some of the products I'll recommend later in the video will help with dry scalp, but first let's dive into the two major skin conditions that can cause dandruff. They are seborrheic dermatitis and psoriasis. Let's explore which one might be affecting your scalp. Let's start with seborrheic dermatitis, also known as seborrheic eczema. The term seborrheic refers to greasy areas of skin where this condition often appears. Besides the scalp, seborrheic dermatitis can affect the face, eyebrows, down onto the middle of the face and around the nose and onto the centre of the chest. Dermatitis means inflammation, so the skin becomes red, itchy and flaky. Now in skin of colour, that redness appears as darker than the normal natural skin tone. In contrast, psoriasis often appears in different areas such as around the ears, elbows, knees and even on the belly button and groin. Psoriatic plaques can be thick, scaly and clearly separated from normal skin, unlike dermatitis or eczema, which tends to fade out around the edges. Psoriasis, on the other hand, tends to cause thicker scaling, particularly on the scalp, and tends to affect areas like the front of the hairline and around the back of the scalp. Now, psoriasis also tends to create well-defined red, itchy areas, and again in skin of colour, the redness, which is due to extra blood flow caused by inflammation, appears darker than the natural skin tone. Do these symptoms sound familiar to you? Drop a comment below if you suspect that you might have one of these conditions. There are still occasions when it can be difficult to distinguish between the two. For example, on the face, in the absence of additional signs elsewhere in the body, it can be difficult to differentiate facial psoriasis from seborrheic dermatitis. Such patients are sometimes termed as having seborrhoeic. Another example, psoriasis can often affect the ear, but so can seborrheic dermatitis. But in seborrheic dermatitis, you can get cuts or hacks at the back of the ear or even around the earlobe, and these can often become secondarily infected with a bacteria, causing a yellowish crust or ooze. Regarding the causes of these conditions, seborrheic dermatitis is thought to involve a yeast called Malassezia, which is present on normal skin but is found in much higher quantities in seborrheic dermatitis. Current research suggests that abnormalities in the skin barrier and increased sensitivity to an oil produced by the yeast, oleic acid, trigger inflammation. And this is why certain natural oils can worsen dandruff caused by seborrheic dermatitis, and they'll also react with the yeast, causing further inflammation. Seborrheic dermatitis can be more common in immunocompromised individuals, such as those with HIV or neurological diseases like Parkinson's. However, for most people, it isn't linked to any underlying illness. In contrast, psoriasis is driven by genetic and environmental factors, often due to immune system overactivity. This immune-mediated inflammatory disease can also affect other body parts, including the joints. Psoriasis isn't infectious, so you can't catch it from someone else. Now, I've done a specific video on psoriasis, and you can check that out later. Both conditions can flare due to environmental factors. Seborrheic dermatitis is often triggered by tiredness, stress, cold and dry weather, while psoriasis flares are commonly seen when the immune system is stressed, such as during or after infection or periods of poor sleep and high stress. Now that you have an idea of whether your dandruff is due to dry scalp, seborrheic dermatitis or psoriasis, let's talk about management. In all cases, the first step is lifestyle management. Focus on a diet rich in water, low glycemic foods like whole grains and vegetables, and include healthy fats such as olive oil and omega-3s. Limiting sugary foods and refined carbohydrates can also help. Quality sleep, regular exercise, and managing stress are critical not only for your scalp but for your overall health. When it comes to choosing products to put on the skin, many people prefer natural products, and if you find one that soothes your scalp, well, that's great. However, some natural products, including oils, can cause contact dermatitis or trigger reactions in seborrheic dermatitis, as I've mentioned above. It's also important to be aware that tree nut oils should be avoided on children with seborrheic dermatitis or seborrheic eczema due to the risk of them developing food allergies from rubbing the oil directly onto the skin. I've had a look on the only natural product found some evidence for of helping seborrheic dermatitis is aloe vera. The gel inside aloe vera can feel very cool and soothing on the skin, and it has anti-inflammatory properties. Studies like this one published in the Journal of Dermatology show that aloe vera significantly reduces itching and scaliness in seborrheic dermatitis. And in another study which focused on seborrheic dermatitis of the face, found that treatment with aloe vera gel resulted in an 80% improvement in symptoms in almost half of all participants, and no worsening of symptoms was reported. I'll link to those studies below for those of you who are interested in the research behind these treatments. If you know or use any other natural products that work for dandruff or scalp issues, do let me know in the comments below. I do read them. If you have eczema or psoriasis, washing your hair can be tricky. Many commercial shampoos contain sodium lauryl sulfate, SLS, which is a harsh detergent that can irritate the skin. Shampoos without SLS won't lather as much, but they are much gentler on sensitive scalp. Now, I've linked some recommendations from the National Eczema Society below, many of which contain ingredients like salicylic acid and coconut oil to help remove scaling and moisturize the scalp. Selenium and zinc containing products are also very effective. Since a yeast is involved in seborrheic dermatitis, antifungal treatments help improve symptoms. Ketoconazole shampoo 1% can be bought over the counter, but the more effective 2% usually requires a prescription. For best results, leave the shampoo in, massage it in and leave it on for about 5 or 10 minutes before rinsing it off. Ketoconazole is often recommended for daily use for maybe 2 to 4 weeks to control symptoms, and then reduced once or twice a week to maintain remission. A newer product, Durcos, can be used as a daily shampoo. While not as potent as ketoconazole, it's great for maintaining remission and contains ingredients like selenium, salicylic acid, ceramides, which are cholesterol-like oils, great for moisturizing the scalp, and vitamin E. All of these ingredients support scalp health, and it can be used for dry scalp too. Scalp psoriasis often creates thick scaling, which must be removed before prescription treatments can penetrate the skin effectively. Products like Sebco ointment, which contains coal tar, salicylic acid and sulfur, are often prescribed to remove the scale. Now, while it can be very messy, it's very effective at softening and removing the scale. Massage the Sebco in for a good 5 or 10 minutes and leave it on for a couple of hours or overnight if you can, protecting your bedding because it is messy. And then wash out with a shampoo recommended by the National Psoriasis Foundation, which also I will link in the description below. That shampoo I mentioned earlier, Durcos, can also be used as a good shampoo at this stage. Once the thick scale is removed, other prescription treatments such as topical steroids or vitamin D analogues will be more effective. There are several combination products available containing both steroid and topical vitamin D analogues together. Despite all this, in some cases where the symptoms are more severe or unresponsive to topical treatments, a type of light treatment known as narrowband phototherapy or even systemic drug treatments may be necessary, but these are only available at specialist dermatology centres. Remember, managing these conditions take time, so be patient as you find what works for you. too. Now, if you're curious about light therapy for psoriasis, I've covered that in more detail in another video. Don't forget to subscribe if you haven't already for more skin health advice, and I'll see you in the next one.